Well, it will be a super agency, a central traffic controller to end duplication through consolidation in the largest healthcare system in Canada. Let's discuss this move with the minister who made it happen. Christine Elliott is the Ontario Health Minister, and she joins us from Queen's Park. Minister Elliott, how does this save money and improve service simultaneously, it would seem?
Well, the reason that we're doing this transformation in the first place is for the people of Ontario, for patients, families, and caregivers who feel shut out by their healthcare system. What we are doing with this transformation is changing our public healthcare system to focus on the patient's needs, and to connect their care needs. So if, for example, they've been in hospital for a surgical procedure and leave hospital and need to be connected to home care, that doesn't always happen right now. And people wait, they don't know when or what type of care they're going to be provided with. And sometimes they end up back in the hospital in the emergency department because of complications. We want to stop that. We want to make sure that we can connect the care so then when people return home, they can become well and back in their own homes and in their own communities. That's the purpose of this entire program.
One thing that a lot of people are bothered by, understandably so, is hallway medicine and emergency wards. And I think there's over 1,000+ patients in hallways or closets in hospitals. How does this resolve that?
Well, it will in a number of ways. One is the fact that we will not have as many people being readmitted to hospital after they've already been discharged, because they are going to receive that connected care in their own homes, so that whoever the home care nurse provider is, he or she will be able to connect with the hospital if there's complications, to make sure that they can treat the problem in the person's home to prevent them from having to come back in hospital. But the other thing that will decrease hallway health care is if we use some of the great models that we already have. Take Cancer Care Ontario, for example. They have some of the best management strategies for cancer and renal indications in the entire world, yet we still have very little infrastructure for mental health and addictions. So if we take the great model that Cancer Care Ontario provides with Ontario Health and then transfer it to other situations, we can really develop a very supportive chronic disease management strategy that will again help keep people out of emergency departments, because we know that there are many people with mental health and addictions problems that cycle in and out of emergency departments without ever really receiving the health care that they need. We want to change that and use those great models and scale them up and spread them out across the province.
One final question on this thing. I'm curious, because sometimes you get these super agencies that know all agencies, funding all agencies, but they don't really know the local scenario where demographics may vary from place to place and healthcare demands are different from one city to the next. How do you account in this system for give it the flexibility to meet the local demand if it's a big super agency hovering above everything?
Well, the health agency, Health Ontario, is going to be the one that's going to be able to plan across the entire province to make sure that there's consistency of care across the entire province and high quality standard of care. It will also have 5 regional operations too, to make sure that regional care is being delivered. But it's really about the Ontario Health teams in each geographic area that are going to be providing that local care to make sure that it's provided by the care providers that already exist there. We don't need to create another administrative structure or bureaucracy to do that. We anticipate there will probably be about 30 to 50 Ontario Health teams locally on the ground that will know the healthcare needs of their community and will be able to deliver them, have the financial accountability and also the care continuity and patient engagement that is so important and necessary.
Final question. You talked about home care, but one thing that takes up a lot of space in hospitals are people that are waiting for palliative care to open up. Do you see that becoming something that will become a new focus for this reform?
Absolutely, yes. Palliative care is really important. We have some wonderful hospices already in Ontario, but I believe there is also a role for home care to play to help people feel comfortable and pain-free in their own homes that may choose to be there with their family when their final days happen. And we want to make sure that we can support patients, their families, and caregivers throughout their lives, from the beginning to the end.
Right. All right. Let's hope it works. All right, Christine Elliott, thanks for joining us. Appreciate this.
Pleasure. Thank you.